And good afternoon, everybody. It's Art Shed with the MedicareHelpGuys.com. That's the website. MedicareHelpGuys.com. We are the Shed Group, but the website again is MedicareHelpGuys.com. Folks, hey, look, we are into the month of September. You received a message from us early during the month of August, getting you prepared for this annual election period, which of course starts October the 15th and runs until December the 7th. During the month of September, you're going to receive your annual notice of change document for 2025. Pay close attention to it, folks, because there are things in there that you need to be aware of. I can't tell you anything about it, right? But you're going to know about it before the 1st of October. But over on page 11 of most of those documents, they're pretty much the same. They're all about 30 pages long in length. And page 11, that's where they start doing the side by side comparison, and you will be able to see what's changed from 2024 to 2025, and in particular with regard to, I think, four areas are really important: the premium that you're paying, the out-of-pocket maximum that you will experience if you decide to utilize services, and of course, inpatient hospitalization and skilled nursing. Why do I pick on inpatient hospitalization and skilled nursing? Because that's the fastest way to get to your out-of-pocket max. It's not going to be, a $30 copay to go see a specialist or an outpatient surgical procedure. It's going to happen if you're in the hospital and need skilled services. So pay close attention to your annual notice of change in those four areas, right? If they look good, there's probably not much for you to do for next year. All right. At that point, once we have those four questions, major questions answered, we can look at the detailed benefits and see if there's anything in there that we need to really be aware of, right? And if you do have questions about your benefits, that's where you give us a call. Number 765-252-1533, or reach out to us on the website and get a consultation scheduled. That's MedicareHelpGuys.com. All right, so folks, that being said, look, I want to transition from the annual notice of change conversation and just talk about CMS. Remember, folks, with the Inflation Reduction Act, we knew that your out of pocket will go down to $2,000. So the amount that you spend in your deductible and your copay costs, once it reaches $2,000, 2025, you're into the catastrophic window, right? Remember that there were four areas. There's the initial, we saw the deductible, and then you have the initial coverage period. That's where you pay 25% of the drug cost. The carrier pays 75% of the drug cost up to a dollar amount. Once that dollar amount is eclipsed, then you're in the coverage gap or the donut hole, right? Once in the donut hole, most people never make it out. But if you do, this year that number is $8,000. If you spend more than $8,000, you're into the catastrophic window, right? And in the catastrophic window, that's where you're paying like the lowest possible price for the prescription that you may need, and up to 5% if it happens to be some form of specialty or experimental. All right, so that being said, the coverage gap goes away, so you're left with three areas to really be concerned with. We've been saying this about the IRA, or the Inflation Reduction Act of 2022, that great that it passed, right? However, there will be some blowback. And in our newsletters, we were telling you that the only way for carriers to make money would be in the premium cost, the deductible cost, and the co-pay cost for your drugs, right? So, and I said in a couple of newsletters, look for the premiums to change, look for your deductibles to change. And I also made a mention in one of the newsletter telling you that, you know what, it's quite conceivable that drugs in tiers could change. So there will be drugs that were probably in tier 3 that will move to tier 4, right? And there could be some drugs that move from tier 2 to go to tier 3. Remember, on tier 1 and tier 2 drugs, those are your generics where you pay either nothing or maybe up to like $4, maybe $8, right? So those things could move. So back during the month of July, so in fact, July 29th of 2029, it's almost like someone woke up in Washington, okay, and said, "Oh my God, these premiums are going to be skyrocketing," right? So, as the plans are being filed with the carriers for the 2025 year, uh, it's like CMS saw that in certain cases, some of the carriers were passing off $200 or better for premium costs. So they were saying, obviously, we can't have that. Okay, so I guess you would say their immediate fix was what they proposed, the premium stabilization demonstration. This is another, I mean, you can look through the document and read it if you really want to. But the crux of this is that for the next 4 years or 5 years, what, 2000, yeah, the next 4 years, they're going to test whether the additional policy changes needed in order to stabilize the IRA. Right, that's the gist of it. What do we need to do moving forward during this test? If you're going to sign up to participate in this test as a carrier, you're going to be paid by the federal government X number of dollars. All right. So, what does this amount to? It amounts to some form of, yes, you could call it a bailout, or you can call it a test. That's just another dress up term to me. It's just another way to kind of keep this from being political, but it already is, right? So, I mean, I'm not here to cast aspersions on one party or another, but as I was saying, when the IRA was being put together, obviously they don't know what they're doing. That's what I was saying in a roundabout way without really saying it. They don't know what they're doing because, carriers get their money really from three different major tranches. And if you're going to shut off one of those, they're going to just boost the other two in order to, well, make it make sense, right? So anyway, but if you're the person that's been keeping score on this since the beginning, which was like 2005, 2006, if you recall, when the Part D window started, when those four coverage windows started, we were told then under the Bush administration that the Part D coverage gap would go away. And it was set or supposed to go away by 2010, 2011. Well, obviously, that did not happen. And the reason why you have the IRA is because that did not happen. But what they put together with the IRA really didn't defray costs and actually ended up creating a bailout situation for health carriers. So, if you're upset with the fact that health carriers receive X number of dollars from the federal government, you're going to be upset because they're now going to get X number of dollars more from the federal government in order to make this stuff work. So, anyway, it is what it is, folks. But in light of all that, just make sure you're paying close attention to your ANOC. Pay close attention to your prescription drugs. Make sure that you know what tiers they fall in now and what tier they're going to fall into in 2025. All right, folks. That being said, I also want to bring it to a close and let you know that over at the Facebook page, I think it's going to be 3 days out of the week, starting on next week. We're going to post in the morning a video for you to watch. It will be Medicare and healthcare related in tone. And then in the 5 o'clock hour, as I'm winding up for the day, I'm going to spend a few minutes and talk about the video, the information, and then, of course, maybe some anecdotes as to what we see in the Medicare space that may be of value to you. Some of the things that are of value to members this year, and really, I think for over the past few years, we're trying to pay close attention to how much healthcare we're actually utilizing, right? So there's one thing to be aware of the system and how it works, Part A and Part B, and the dental vision here. But then there's another thing. There's another thing to be aware of the system as you're utilizing it, right? So utilization of the system is a total number, and the number we should be paying close attention to. We want to make sure that that stays on average. The average person spends about $600 a year when it comes to healthcare costs. A lot of that is Medicare Part B. Why is it just B? Because we're relatively healthy, right? As we're relatively healthy, we don't spend a whole lot in healthcare. As our health changes, right, then we start to spend a little bit more when it comes to healthcare. So pay close attention to the website. Pay attention to the Facebook page. If you're going out to the website and need to schedule an appointment, go out to the MedicareHelpGuys.com. Go up to the top right-hand side, schedule your consultation. We can do a meeting by Zoom. We can do a meeting in person. However you wish to do it, just make sure you get it scheduled or give us a phone call, 765-252-1533, in order for us to just kind of talk about what you got going on and whether or not there's something we need to do. It's our job to be as helpful and I would say concierge type as possible, right? So we know the system can be complex and daunting, but we are here to help. So that being said, folks, hope you have a great afternoon. Look forward to seeing us throughout the month of September as we put these videos out, getting you ready for the annual election period. So have a great afternoon. We'll see you soon. Take care.